Rock on Johnny in Teabba Radio this morning. Like we usually do every morning on Monday. We get Salimon, Dr. Salimon Joseph, the audiologist, ear doctor, and coming in.
Good morning, Rockon. Good morning. Another wonderful Monday morning.
Another one, yeah. Really bright Sunday, a bright sun out, eh?
Absolutely.
Yeah. And you came in this morning and thing there, and what you wanted to put on the table today?
Absolutely. I was thinking, as we discussed before in the morning, that in audiology, taking case history is very, very important. And many times the client will have a presenting problem. So that is why I generally give 1 hour appointment to my client for audiology assessment.
Yep.
But if it is wax removal or ear wax removal using microsection, that will be half an hour. So 1 hour, why that 1 hour is so important? Because we need to get what is happening with the client. Okay, the client may say, I am not hearing my partner. Okay, if they have in a relationship, sometimes the person will say, I am not hearing, or at workplaces, I am not understanding my work colleagues.
Mm.
So that may be one of the problem. Okay, then we will ask, okay, how long you had this problem,
Yeah, it's like I'm getting the history and stuff.
Absolutely, the correct history. And and then the other important question an audiologist need to ask is, do you have any ringing sound in the ear? The technical term for the ringing sound is called tinnitus, the ringing sound. It can be high frequency, mid frequency, or low frequency. And the other important question is any noise exposure, because a lot of tradies, they work in a noisy place.
Yeah.
And power tools, they use power tools. In the early years of a plumber or electrician or a mechanic, they may not be using hearing protection.
Yep.
And later on, they realize that hearing protection is their responsibility. And if they are an independent mechanic, they will realize, a tradie, they will realize that it becomes their responsibility. And the problem is noise exposure will have a hearing loss in the high frequencies. And the high frequencies can affect their understanding of their partner, especially if the partner is a female.
Yeah, it's just like seeing people working at mines and machineries and stuff like that, working with really things that makes a lot of noise, like them baggage handlers at the airport.
Absolutely.
They walk around with headphones and things there to stop all that, that ringing in the thing there, otherwise it will affect your ears.
Absolutely. Not only that, there are people who work in defense forces.
Yeah.
The problem is when they join the defense force, they never understand. Okay, no one will tell them you will be working with the firearms, explosive devices, tanks, fighter jets.
Yep.
All these are very, very high sound that can create hearing loss. Not only hearing loss, it will create constant tinnitus. That tinnitus can be lifelong. So that is why a lot of DVA clients come here with an audiologist for audiology assessment, DVA requested audiology assessment, and tinnitus assessment. And any trauma, we need to ask the client, okay, have you had any trauma, any discharge coming out from the ear? So these are basically for the adult clients.
Yeah.
But when we talk about the pediatric population, the questions are slightly different.
They're pretty different.
Different questions. Different questions, because their concern would be very, very different. Because a year 1 child or a year 2 child, the teacher may notice, okay, most of the teachers now, they need to rule out before they join a school, they need to rule out the child has got normal hearing or what about the vision of the child. These are the 2 faculties that will affect a child's development in the classroom. Engagement.
Most of the parents sometimes don't understand when they're tugging on their ears too. The little one could be feeling pain, or?
Depends, because I will go through this one. For a child, what we need to ask is, we need to ask the parent, do you have any concern regarding your child's hearing? because the parents spend majority of the time with their loved child. They will have better understanding regarding their hearing ability. We can diagnose it through our machines, but when we take the case history, we need to ask, okay, do you have any concerns? And if you have any concerns, or if you don't have any concerns, then the next important question is for a child is, how is the speech and language development?
Yeah.
The speech and language development, even for a pediatrician, is so important that they need to have, before the pediatric appointment, they need to have vision test and audiology assessment.
Yep.
And some children, they have normal hearing, but their speech and language will be significantly delayed.
Like if they have the ear problem and stuff, do audiologists or doctors check in their other symptoms and stuff like? Because I mean, like if you have a sore throat or cough, like knowing that fluid, what they cough up, it travels up through the ears and stuff like that and thing there.
Right.
Do they check like throat and like kids when they get like chest infection or anything there? Because when you have a chest infection and stuff, it does affect your ears and stuff there too.
Absolutely. That is why whenever we go to a GP, generally they take the pulse and then they will look at the throat and they will look at the ears.
Yeah.
All those things they have to
like the little baby got temperatures or thing like that.
Absolutely. And some small babies, they cannot express their pain.
Yeah.
And that is why they pull their ears.
Yeah.
That is one of the things the parents say.
They feel lethargic too, real weak and stuff like.
Absolutely.
Do they go in and out of that on thing like that?
Majority of the time they will have a restless sleep.
Yeah.
Whenever they have ear infection, because there will be pain and discomfort for the child. That is why the role of audiologist is very, very important, because we have a machine in addition to the otoscope. Okay, the otoscope is a tool which uses to look at the ear. Look into the ear. And in addition to that, we have a machine called a tympanometer to find out how well the middle part of the ear is working, how well the eardrum is vibrating, there is fluid collection behind the ear or not. All those things we can find out. And when after asking the speech and language relay, we need to ask, is there any family history of hearing loss? Okay, there are some families where the mother or father will have congenital hearing loss. They're born with the deafness. So there is a possibility, if the parent born with the deafness, there is a predisposition, it can get to the child. Okay, that is why the other important question is, did the child pass the newborn hearing screening? Since 2000, we have a compulsory newborn hearing screening in Australia. Every birthing hospital, the child will have a newborn hearing screening. That will be done by a nurse, but an audiologist trained a nurse.
How many months the mother has to bring the little one in?
That newborn hearing screening happens immediately after the delivery, maybe 1 day or 2 days. The child need to have a 1 or 2 bath. At the hospital. And then because the child is lying down in the amniotic fluid in the uterus. So there is possibility of amniotic fluid in the ear canal when they're born. That is why 1 or 2 shower. That is why they won't discharge on the same day of delivery, isn't it, at the hospital? After 2-3 days only they will discharge the baby and mother. So during the time, the nurse at the hospital or the birthing hospital will do the newborn hearing screening, and we can find out what is happening. It's only a pass and refer result. They will get it. They will do it twice. And if they even at the second time, if we are getting a refer result, then the child will be referred to a diagnostic audiologist, and the audiologist will do the proper hearing assessment, and the audiologist will make the diagnosis, and we will refer to the client at the right appropriate places, because Hearing Australia is an organization that fully funded by the Australian government. They will do the amplification and all the other thing involving, depending upon if the child has got hearing loss, the child will need hearing aids. And
then the track, as they gradually like grow up and think like 2 or 3 years time and stuff, the audiologist check them every
year or
like
so.
a year or so.
Every year or so, yeah. Yeah, because up to the age of 5, the brain plasticity of the child is at its peak.
Yeah.
So that is why the early identification of hearing loss is so vital that in your community and in my part of the world in Kerala, there are a lot of deaf and dumb children.
Yeah.
They don't speak.
Yeah.
They only have sign language. And once upon a time in 60s or 50s or 40s, we haven't had a fully fledged audiology department in the world.
Yeah.
And since after the Second World War, I think the audiology research went very, very exponentially, because a lot of army personnel, they were using tanks, because the firearms,
all the firearms and everything,
without any hearing protection, they all lost the hearing.
So as you were saying there, gotta ask the parents of all the questions and stuff now, and to or ask anyone what sort of symptoms they've got and thing there. And with a little baby one, it's a different question. Eh?
It's a different question. Okay. And that is why an audiologist who has got a diagnostic ability as well as a rehabilitation ability is very, very important, because people are spending money to an audiologist to find out the problem.
Yeah.
Okay. Because their time is very important. Our time is very important. The client need to get the result what they want.
Yeah. Because they stuck with the problem there of not hearing and thing there, and once they get some answers for that, it'll be a really good thing, an outcome to it then.
Absolutely. The clinician, in my opinion, every clinician need to step up to the level of their service, up to the level of the expectation of the client. And this is a service industry.
Yep.
In a service industry, we have accountability towards our clients.
Yeah.
So we need to step up and reach up to their standard. Then the client satisfaction will be at its peak. If you look on Google at the Territory Hearing reviews, you'll be astonished that I only started 2.5 years back, almost 200 plus 5-star reviews.
Yeah.
The people are very happy because, I am not working for anyone. I am working for myself.
Yeah.
I am not reporting to
that's
anyone.
a good thing.
That's a good thing.
Very good thing.
The freedom. And then I will give ample time to my clients. And then I step up to my level of, up to their expectation.
Yeah, that's really good, because what you said now with with all the symptoms and stuff and of hearing and thing there, and it also gives us our balance when we walk too. So we got to be very careful and look after our ears, and just to hear and to walk the proper way.
And this is the clinical skill is one thing, and the other important thing is people skill.
Yep.
We need to welcome the client. They need to feel at home.
Yeah.
And warmth. We need to engage. When they say something, we have to actively listen.
Yeah.
And look at their eyes. And whenever a child comes to my clinic, maybe I will give a sticker or a lollipop or something to make them happy.
Reward them a bit.
Reward them, to make them, as soon as the smile comes out, they will engage with my testing and they will cooperate. It should be, I always tell my clients that today's world, it need to have a positive experience. Yeah. Every interaction with any individual, a clinician or any other person, should be a positive experience. It should not be a heartbreaking Okay, it's a
Yeah,
sad
make them
experience.
scared and things like that.
Scares.
Right? Yeah.
In our childhood days, we were afraid of seeing nails
Yeah,
or
yeah, especially when I was small.
injection, needle, okay, the pain, okay, and the children will remember that room. Oh God, okay, so I started to cry. So in audiology, I always tell them you need to have a positive experience, and I will create that atmosphere for every person.
Oh, well, yeah, all your countrymen out there, all your listeners, yeah, just want to say good morning to everyone and thing there. And just remember what Dr. Salimon just told us here now about hearing and thing there. So, yeah, he's going to be asking questions and stuff there to find out properly your problems of your ears and with little kids, they're pretty different and stuff there with all that asking the question and thing there. And yeah. I'd like to thank you for coming in again this morning on a Monday.
Thank you very, very much, Brendan. That's a pleasure. Thank you very much for rock on, John. Sorry. Thank you.
And yeah, I'd just like to thank Dr. Salimon coming in again and think that he's got his own private audiologist thing down there in Muirhead. And now Muirhead is down in Buffalo Creek Way. And yeah, he's got a good little place down there that checks up with clients and stuff all the time down there, and really really good to see you again, and
Thank you,
hope you have a
Rocco.
good week, and we'll get back to some music now. Bit of Tommy Toots and yeah, bit of Jenny.